So Dr. Tirosh, still here? I do have a question for you. In the pressure insole, did they have to investigate the sensor properties and take measures to keep the accuracy, like such as sensor material creep, mechanical sensor drift, temperature drift, sensor crosstalk, to reduce the that appeared to have reduced the measurement accuracies?
Yeah, so we didn't look at it. The people that worked on it were more a clinician, not a lot of bioengineer researchers. So what you suggested wasn't in our site, which is very important to take it further. What we were interested is just to show a proof of concept of the use of it in clinical setting, mainly in clinical setting and less for research. Surely for research, you need more accurate and more testing to make sure that you get the accurate results. But I'm happy for someone to take it from here if they are interested and to work and look at all the things that you suggest and even further.
Thank you. We'll take one more question here and then we'll pause for a quick photo and then continue with the rest of the session. Dr. Tirosh, you spoke of many motion capturing options and applications. While it's convenient to carry it with you, it's not one of the disadvantages of the wearable sensors is that it is wearable. Have there been any studies about the effect of these sensors on the actual performer, especially in high-impact, high-speed sports? About the restriction of movement, is it comfortable, and so on?
Yeah, so these sensors are very good. Are also in high speed. So these sensors can get to, let's say, without the filtering, you can get to 800 hertz, which is fine for sport. For sport, from my experience, 200, 250 hertz will be fine. 500 is better. So the sensors are available, and they're very accurate. The problem that you will face is not the hardware, is the signal processing and the interpretation of the data. And this is what is tricky. There's a lot of work on signal processing, filtering, machine learning, work with the drift, like serometers are not so good with the drift a lot. Gyroscopes are much better if you want to. They're more accurate and more reliable, I would say. And so that's what you will face. The difficulty is the signal processing and make meaning sense out of the data. So for the engineers, they just happy to work with these signals and do all these algorithms. But if an engineer will present it to a clinician, the clinician will have no idea what does it mean and how to make sense or interpret this to a clinical meaning. And this is what I faced through my work, trying to simplify the data and the interpretation for clinicians and surgeons, especially surgeons. They don't have time to learn about their signals. They just want very simple graph, give me a number, what's happening. So this, I think, the tricky thing that a lot of people are trying to figure out.
Since you did bring it up, let me quickly ask another question. What's the difference between the mean pressure force and peak pressure of force for gait analysis, and how is it important?
Well, I guess the mean pressure is, so if you got depends. If you talk about a cycling movement, so you got a lot of pressure, you will say this is the mean of all the cycles. So one cycle can have the peak force, and some people will say, let's take the mean of 10 cycles. And this is one. The other thing is if you talk about sensors in the insole, so you have a lot of sensors. So it's the mean of all the sensors forces, or the peak will be the maximum. That will be my interpretation of what you're asking.
Thank you. And for the participants, please send your questions so early on during the session so that I can combine some of the similar types of question and ask the speaker. This is a little bit related to my earlier question regarding the natural trajectory of the ball when you put sensors inside. Would it be practical or ethical during a match for that to be used?
So I understand you're talking about the cricket ball.
Yes, sorry, yes.
Yes, yeah. So the cricket ball, the objective of the cricket ball is actually to look at the spin, not the trajectory. We were interested in to look at the spin of because the spin, and you guys, I mean, the Sri Lankans, you are expert in the spinning. Although we had Shane Warren, but you guys are, I think, in the modern era, you are expert and you understand. What we did found with the spinning, that when we did start to do some testing, we did found that some of the spins are not what the manual book teaches us. So actually, it's a bit different. So it gives you some insight of actually what's happening when you spin the ball, because it's not what you read in the manual book of if you do this and the ball will spin here. It actually does some other things. So that was the objective of the work, looking at the torque when you release the ball and the spin of the ball during the trajectory. So it's not actually the trajectory of the ball when it flies, it's mainly the spin of the ball. The trajectory will be quite difficult. We do work on the trajectory now. We got a PhD student working on it, but it's quite difficult to calculate. Because, as I said, the accelerometers are difficult, very noisy, difficult signals. The gyroscope, the angular velocity, it's more easy to work with more reliable and valid signals. So, yeah, so that's it's the spin.
Okay, and the spin doesn't change because you have sensors inside.
No, it doesn't change. No, yeah, there are good papers that we came out. I didn't put them there, but there are some good papers. The spin doesn't change. Actually, it teaches you that what you think is not really what it is.